Hi, guys, and welcome back to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing that we ask is that if this episode helps you live just a little bit better and a little more aligned, that you'll leave us a review and you'll share it with a friend. That's all that we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being. So today we're going to be going over really the basics of everything oral health related. We're going to be talking about how your oral health affects all of the different parts of your wellness and your body, a basic brushing routine, about flossing, how often you should be seeing the dentist. We're going to be talking about x-rays. We're going to be answering all of your questions that you guys sent in and really just dialing down the basics because your oral health is something that impacts every single part of your life. Today's guest is a phenomenal friend of mine and dentist. She graduated Magna Cum Laude from Creighton School of Dentistry in Omaha, Nebraska. And she came back to Coeur d'Alene and is now one of the dentists at Kootenai Dental Group. She's also the MVP of the right field in softball. Miranda, thank you so much for being on. We actually just recorded like 5 minutes of the podcast and turns out we were recording. So for the second time, thank you for being on, Miranda, and for taking time out of your busy schedule to do this. I really appreciate it. And I'm excited to talk to you. I'm so excited. Yeah. So before we start the podcast, I always like to ask each of my guests, what does wellness mean to you? There's no wrong answer. And it's so interesting to see like every person from their walk of life and their field of expertise has like a unique twist on it. So I guess as a dentist and just as a human being, what's your definition of wellness? So I actually went to a dental lecture probably 5 years ago, and I went to a nutrition course, and the lady that was giving the presentation said, it's something that really resonated with me. She said, we focus on health and wellness in order for when we inevitably get sick, we can fight it. Mm-hmm. And that just like triggered something in me where I was like, wow, it's so true, because there's illness and sickness and cancer and disease everywhere. And we stay healthy, so when we inevitably get sick, we can fight it and live longer and be better and stronger. And that was something that really resonated with me. I love that. It's like this preparation and like this vitality. Because like stuff's gonna happen in life. Yeah. Like sickness is gonna come, injuries are gonna happen. Yeah. Like sickness is gonna happen, and it's how you bounce back. 100%. Yeah. So obviously, you are Dr. Miranda Anderson, which is incredible. Congratulations. It's a big accomplishment. Thank you. Especially at such a young age. Do you ever have patients when they come into your office be like, are you the doctor? Yeah, I get told that I look like I'm 12 pretty much every day. And then they start talking to them and they're like, okay, she knows what she's doing. Yeah. Yeah, that's the goal. I mean, I just give people the knowledge that they need to make the decisions for themselves, and try and help them best I can with the knowledge that I have. And yeah, it's really fun. So, oh no, you're good. So before we get into it, what do you feel like is like the most rewarding part of your job and the part that is just like the hardest? Yeah. It's so fun because my day-to-day is different. I'll look at the schedule at the beginning of the day, and by the end of the day, it's like not what I expected at all. Yeah. Because I deal with a lot of people in pain. I deal with a lot of people that have severe anxiety, don't like to go to the dentist. Mm-hmm. Like I get told that I'm hated before I even meet people. So it's so many people have a fear of the dentist. Oh my gosh! Like. So yeah. And it all stems from childhood or from their parents having a fear of the dentist, and then they pass it on to their kids. So I think I do a good job of making people feel comfortable, and I hope so. I mean, that's always the goal. Yeah. That's one reason I love where I work, because we really focus on patient comfort. And making sure that, we're not rushed into, like, it's not just a go, get things done. It's making sure people understand what treatment they're getting and why they're getting it, and doing it with as little as pain as possible.
it's really cool.
That's so cool.
Yeah.
I love that. You say you also like sing to your patients, right? I know Miranda has a good voice. That's really cool.
I do.
Okay, so getting down to just the basics for people listening, why do people need good oral health? Like, this is such a basic question, but just setting the foundation, like, why does oral health matter?
Well, and I think it's not talked about very often. Like, I didn't know anything about the mouth until I moved to dental school. Yeah. Like, even when I was applying to dental school, I didn't even know proper techniques or like how a cavity forms. You just think it's sugar that sits on your teeth and causes a cavity. No, it's the bacteria in your mouth that are eating the sugars, releasing an acid, and the acid is what's breaking down your tooth structure. And so what you want is to make your teeth more acid resistant so you're less likely to have that breakdown of the structure.
Before we even like dive into like the science and like all of it, it's just, I want to touch on what you said. How it's something that we don't talk about a lot, and yet it's something that we do every single day.
Yeah.
Like, hopefully multiple times a day, right? Like, we eat all the time. Like, even like we're drinking coffee right now. Like, what is that for our teeth? Like, I'm sure it's not good. You tell me. So, like, it's like our mouth is like one of the first things that people see, like when we smile, right? Like, it's one of,
it is like the window to your
you can't eat if you don't have your teeth. It matters so much, and we don't talk about it. And then even, which we can touch on this later, but how oral health affects everything else in your body.
100%.
Yeah, so 100%. It's crazy that it's not talked about enough. And like, I'm sure there's so many misconceptions. So just like brief misconceptions, like, are there things that you're like something that you're like as a dentist you like want to debunk for people listening?
I think what I didn't realize until I became a dentist was how like lucky I was growing up with parents that taught me how to brush my teeth morning and night. And then I go to work now and I see teenagers that like their parents didn't give them that example. And then their parents are in dentures, so they're like, oh well, yeah, I'm gonna get dentures because that's what my parents did. What people did. It's like the generational like cycle. And yeah, it's great. It's pretty eye-opening seeing that in our own backyard. Like, a lot of times you think you have to go to a foreign country to try and help people who don't understand things, but it's actually like right here in our own backyard. Young people that are, like, I'm taking out all their teeth because they don't know how to take care of them.
Yeah,
and it's kind of crazy.
For all the patients you're seeing, what are the most common dental issues that you see in your clinic?
I have a lot of older patients at my office, and they're on so many medications for this, that, and the other. And it's just crazy the amount of side effects that you can see in the mouth, such as like dry mouth. That's something that I've struggled with lately with some patients. They come in, their doctor put them on a medication, and it causes dry mouth. They don't even necessarily realize that the damage that dry mouth can have on your teeth. And 6 months later, they come in and they have a mouthful of cavities. And then we decide what we want to do. We can fill them. We can take the teeth out.
And dry mouth, is that just like your mouth being really dry?
Your mouth being really dry. Yeah. And so saliva acts as like a natural mouth cleaner. Like, when you have good salivary flow, it's basically washing your teeth.
Right.
Any kind of carbohydrate that's left on your tooth.
So when you don't have that,
there's no flow and the carbohydrates just sitting on your teeth. If you're not brushing or getting everything, which, I mean, a toothbrush is going to get a lot, but your salivary flow actually helps like significantly after you eat.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanethealth.com to get your supplements. My personal favorite is the Premium fish oil filled with omega-3s. Again, you can go to rareplanethealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on, premium, intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massaged or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode.
You mentioned like, even for a lot of teenagers coming in, like just not brushing properly and being like, oh, I'm going to just get all my teeth pulled and my mouth replaced. Does that happen a lot? All the time. Yeah. Yeah. It's actually shocking to me. And I still tell people like your natural teeth are what keep you healthy. Mm-hmm. Like dentures are a great replacement if you don't have teeth. But keep your teeth, please.
You would think everyone would that. I feel like something that I love about wellness is just like rituals and like how you can, I feel like you can make life really magical. It's like a good workout routine or morning routine or like even supplements or like just like learning. I think a huge part of wellness is like vitality, like savoring life and like being present to life. Mm-hmm. And I think talking about how a lot of people, maybe their parents don't educate them on like a proper cleaning routine. Exactly. Yeah. Like there's a way I think to ritualize even like oral health. Me personally, like my natural disposition is not routine, but I've started to like really appreciate the beauty and like a good routine and having the results that you see later on. Totally. So what are kind of like the staples of just like a good oral hygiene routine that everyone should be incorporating into their like wellness? How often should you be flossing? How often should you be brushing? Yeah. What does that look like? Yeah.
Well, I always tell people, if you're not flossing at all, we start with little steps because you can't go from not flossing to flossing every day. Mm-hmm. So I'm like, okay, every other day, once a week, on the weekend, whenever you can, you set goals for yourself and then like slowly, eventually try and build up to all you need to do is floss once a day. 100% floss before you go to bed. If you think about all the foods on your teeth for the whole day, floss before you go to bed. Awesome. Brushing, honestly, you just have to disrupt the film on your teeth. So it's always recommended brush twice a day. Doesn't even necessarily have to be morning and night. Honestly, I feel like just like with what you just said, it's like in anything you do wellness related, just starting is like the biggest thing. Yeah. Like you don't, I feel like it's not really so worried about getting like the perfect optimized, like I need the perfect workout plan, but it's like just get in the gym. Like go like, I feel like people do the same thing with like investing or saving money. Totally. It's like it's so overwhelming to try and be perfect. So start with little goals and like work your way up until it becomes part of your routine. So if you're not flossing, just start flossing. Just start once a week. And then you'll realize how good it feels and you'll love it. And then you'll be like, wow, I should do this every day. And then you will. Yeah. But if somebody's like forcing you to do it, then you won't. Is it normal for your gums to bleed when you floss? So any kind of bleeding is infection. So how do you, let's say someone is that dish now and they're flossing, like they haven't been flossing, and they see bleeding and they're like, oh, this is uncomfortable. Should they just keep doing it? Keep doing it. It should take about, typically, a normal healthy person, about 3 weeks and the bleeding should go away. Yeah. I know for me, when I first started flossing, I had gone, I don't know if this happens to everyone, but I feel like when you go to college, your dental hygiene is so, I always say I'm a very relatable dentist because when I went to college, I came back and I had 8 cavities.
It's a dentist. That's crazy.
So I think it was pretty similar. Whenever I see a kid that's almost about ready to go to college, and I'm seeing a lot of them right now, I warn them. Say, hey, when you get back from the bars at night, come see them. brush your teeth. Yeah. Floss, 'cause those sugars, oh my gosh, they'll just...
No, 100%. So when I first came back from college, I don't think I had flossed in a long time. Like, it's embarrassing. I feel like I shouldn't be saying this to dentists. But
don't judge. I don't.
I haven't, and I know a lot of people listening can relate. But I started flossing, and it was exactly what you just said. Like, for the first week, it was like so uncomfortable. I was bleeding every time. But then, after doing it for 3 weeks, like, and now I've done it for like 2 years, and my gums feel so good. You'd be so proud of me. I do it every night.
I'm so proud of you.
But it does go away after a while. So if it's uncomfortable at first, do it anyway. And then, okay, hot take on brushing for a lot of people. It's like, do I brush before or after breakfast? What's the right way to do it?
So technically, your teeth start to demineralize right after you eat.
Okay.
And they take about 30 minutes to rebuild. So technically, you should wait 30 minutes after you eat or drink anything to brush your teeth. But I don't think it really matters.
Yeah. That's really like all brushing is brushing.
Yeah. So all you have to do is disrupt. There's a layer of biofilm on your teeth, and you have to just disrupt that biofilm. That's why you're flossing. That's why you're brushing. I even tell people, like, some of my patients really struggle with morning and night.
Yeah.
So sometimes I say, okay, brush on your lunch break.
Yeah.
Brush in the car.
Yeah.
Like, literally leave a dry toothbrush in your car and brush while you're driving. You don't need toothpaste. You just need to disrupt that film that's sitting on your teeth. And hey, I call that a win. Like,
do you keep a dry toothbrush in your car?
I don't. I brush every morning and every night.
Yeah.
Religiously.
I love what you're saying of it's less about perfection and more about consistency. It's like in whatever way you can get that done.
Whatever schedule. I know life gets busy, and like, I'm a dentist, so I'm like, you're busy. No, but like, this should be a priority. But like, in all actuality, you know, putting food on the table for your kids is more of a priority for a lot of people. So I understand that too, but you have to like find time, and it might not be perfect, but you have to find time to take care of yourself too. And I mean, if losing teeth is just not the way to go,
not worth it. It's worth taking the 30 seconds out of your day to, or I guess it should be more than 30 minutes.
But hey, let's go. 30 seconds, we'll take it. I'll take what I can get.
So let's follow this for a second. Proper brushing technique. Like, if you just had to dumb it down for all of us.
Yeah. So I use a electric toothbrush.
I do too.
Sonicare. Sponsor me.
Sponsor me too while you're at it.
I love my Sonicare.
Yeah.
Some people really like Oral-B.
Mm-hmm.
Soft bristle toothbrushes are the way to go, because you really don't need to brush very hard just to get that layer of biofilm off.
Yep.
And focus on your gums. If they're bleeding, keep brushing them. That's like, don't avoid the area if you're bleeding. Like, brush it more.
Gotta go through it.
Gotta get through it. You can do it. A lot of people avoid their gums. Brush your gums. Brush your tongue.
Mm-hmm.
Brush it all. 2 minutes. That's why I like my perfect electric toothbrush, because it times me. And so I'm not sitting around like, oh, I think that was 2 minutes.
Mm-hmm. How often should everyone be visiting the dentist for checkups?
It's kind of our routine to just do every 6 months.
Mm-hmm.
So twice a year. So most insurance companies will cover too.
Is that like, even if I'm not having any problems with my teeth, I should still be getting them checked?
Yeah. The issue with teeth is you don't know there's a problem until it's an extensive problem. So cavities typically don't hurt until they're really close to the nerve.
Mm-hmm.
And if they're into the nerve, then you need a root canal.
Yeah.
Or take the tooth out. Or the pain's not just going to go away on its own.
Mm-hmm.
So that's why it's good to get them checked out, get dental x-rays, because we can see if that tooth structure is starting to break down. And once it reaches, once it gets big, you just really don't want it to turn into a root canal. That makes me sad when I see that. Like, this could have been prevented.
Let's talk flossing technique.
Yeah, a lot of people don't know I didn't know this in dental school. So it's called the C-shape technique.
Okay.
So when you floss, you want to go along like the contours of the tooth.
Interesting.
So don't just snap it in, snap it out. Go along one side of the tooth and then go along the other and really like push up against it to get rid of anything in there.
Yeah.
That's something that a lot of
And then
people
if you're trying to have like the perfect oral health routine, how many days a week are you flossing?
every day, once a day. Cool.
Can you get excessive with like brushing and flossing?
You can. It's really hard to do a lot of damage with it. A lot of people have a misconception that if they have gum recession, that it's from brushing too hard. And most of the time, it's actually just from how they're biting together. And so I'm really into like functionality of your teeth and how your bite comes together. I mean, with the stresses of our society today, people are clenching, grinding, and that wreaks havoc on your teeth. And that can, I mean, I talk about your jaw joint too. Like, it's all like a machine. Your jaw joint, your muscles, and your teeth all act together. And if one part of them is out of alignment, it can mess the whole thing up. And that can cause migraines, neck pains, you name it.
Yeah.
Tooth pain. I mean, some people come in and they're just like, my whole mouth hurts.
Yeah.
And it all stems from they're having jaw joint issues because their teeth are malaligned. And then they're grinding at night because they're stressed. It's just like,
yeah. What do you do for people who are like in that situation where it's like, you see that they're either grinders or they have jaw issues and misalignment? Is that where, or I guess that's kind of a stupid question. You go with an ortho, but I don't know. What do you?
Well, it depends. I do a lot of Invisalign.
Yeah.
And that's a great option for people if they're good candidates. Where we basically, if your teeth are all malaligned, we can get them in the position needed to at least better where they're at. Like you want to be hitting your back teeth and hardly any on your front teeth. So we actually do a scan on most patients, and it will show you the bite. So like it'll show red where people hit hard. And so I can literally show you a picture and say, look, you're hitting on your front teeth. It's red. Those are going to start to break down over time. So if we can get ahead of it before it becomes a problem, that's what I like to do. I don't like to mandate things. I like to go to fix the root. Go to the problem. Yeah. Which a lot of times is alignment.
So I'm sure for a lot of our listeners, when they go to the dentist, right? Yeah, you have the hygienist who's like checking your gums and they're checking your mouth, and they do all of this like 4-3, 4-2. Oh, yeah. 1-2, like pocket measurements. Yes. Yeah. What, for people listening, explain pocket measurements. Oh my gosh. What I mean, what do you want? Like if you hear them spouting numbers. Yeah.
So basically what we're measuring when we probe is, this is the tooth and Natalia's and this the tissue. So we're measuring, there's a connection down here between the tissue and the tooth. So we're measuring where that connection is. So that connection, when you're measuring, 3 millimeters is what you can reach with your toothbrush. And so if it gets into 4 region, that means there's some inflammation there. 5 to 6 millimeters is really, it's a deep pocket. And so that's when I have to go in and do like a gum therapy, where we use special instruments to clean them out. A lot of times we'll get people numb because it can be pretty painful to get down there, get the tartar off that's down there. So all that tartar is calcified plaque. So it's just plaque that's been on your teeth. It turns really hard. You can't get it off with your toothbrush, and it will just continue to build over time. And any kind of rough surface is what bacteria likes to adhere to. So that tartar's rough. Bacteria can adhere to it in your gums. That can cause bone loss, which can cause tooth mobility, tooth loss. So as soon as we start to see higher numbers, 4s, 5s, 6s, that's when we want to get in there, take action, clean them out, and then have you back more frequently for cleanings, just to make sure it doesn't progress and get worse.
So what is the number that you want to be hearing?
Anything 3 or less.
3 or less. Okay.
3 or less, but we're hoping for it.
That's good.
Yeah. Because then you can clean it. It's cleansable.
Going back to talking about how so many of these things are interrelated. You were talking about like stress, right? Causing grinding, teeth grinding or jaw pain, or like, it's so interesting how the body really is this one holistic system. Like
It's all connected.
it's all connected. What are some connections between like oral health and overall health? Are there any other connections like that where it's like stress causes grinding or bad breath? Well, I don't know.
Yeah. I mean, pretty much everything there has been studies, correlations that have been shown. I mean, even if you have gum disease, people they've found that in the brain of people with Alzheimer's, the same bacteria. Same thing with like heart failure, infective endocarditis, mouth bacteria that gets into the blood, can cause all sorts of issues. So if you're not keeping your mouth clean, and that bacteria at bay, it can lead to a multitude of issues, diseases.
Yeah.
So we want to get that under control.
So it's important. It matters.
It's important.
Obviously, you want to take care of your mouth, just because if you've ever had a tooth that hurts, it's painful.
It's the work. You want to know why?
Yes. Tell us.
Because, okay, in your body, if you have inflammation, your skin will swell, right?
Right.
If you have inflammation in your tooth, there's nowhere for it to go. So it swells and it hurts because it's hurt. Like the tooth cannot swell. So it just is like that pressure.
So it just keeps building pressure.
And that's why people want to just take the tooth out themselves sometimes because it's so painful.
Have you had anyone ever tried to do that?
Oh, yeah. Yeah.
So bad.
100%.
Yeah.
But what happens is then they break the tooth because...
And then it's even worse.
Yeah.
You have to...
And then I'm digging for the roots. It's fine. That's what I do.
But no, that makes so much sense. And it's we want to avoid that at all costs.
Yeah.
It's so painful.
Yeah. So get your checkups and that will lead to less tooth loss.
So then there's the topic of like oral cancer. There's oral cancer as well. And what are early signs of oral cancer that people should just be aware of and be looking out for?
So any kind of patchy areas in your mouth, white spots, red and white lesions, anything that's changing color, shape, texture, get it checked out. Like, it's super easy to biopsy things. We can send you to a surgeon. But get it checked out for sure. Common places for oral cancer, the side of your tongue. Who's checking the side of your tongue?
Nobody.
I do. I check everybody's tongue.
Yeah.
Like, that's a really common place to get it. Back of your throat. Throat cancer is not something that you want to go through. But if you catch it early enough, it's definitely treatable.
It goes back to what you were saying earlier with why you should still go in to get a checkup, even if you don't feel like anything's wrong.
Yeah.
It's because a lot of times you won't feel anything until it's too late. And I think that's like for 100%. And that's for so many areas of our body. It's just like be preventative, be checking up on it. It's better to catch it early than catch it late. Check the side of your tongue or have Miranda check. I got you. Along with that, do you notice, just curious, since you spent so much time studying teeth, working on teeth, looking at teeth, do you notice, like, do you have a hard time with conversation with people when you meet a new person? Like, do you ever like notice like teeth problems or stuff that you're like, man, if you're sitting in my chair and I would tell you that you need to get this checked out because we're talking, it's like I don't know if that makes sense. But
yeah, no, it depends. I mean, I always people see it, but like if they have a traumatic bite. Yes.
What does a traumatic bite mean?
Well, that's a hard question. For instance, like how I was talking about biting too hard on your front teeth, or if you have an open bite, meaning some of your teeth don't come together at all. So like ideally, when you bite down and you grind side to side, your canines should be the only teeth that touch.
Not me doing that right now. I'm trying to see like your canines should be the only teeth that touch.
Yeah. Or else you're putting forces on your molars that molars are meant for your bite, like your chewing forces, not for side to side. That's what your canines are for. So you just want to make sure everything's in the right spot, because if not, then things are going to break.
Right.
And it could not be good for you.
Right.
So that's why I try and educate people. Hey, this is what your bite looks like. This is what it should look like.
Yep.
And this is why if you don't do something about it now or soon, we're going to have problems later on, and we're going to both be saying, oh, like, why didn't we talk about this sooner?
Okay. What about mouthwash? How do you feel about mouthwash?
Mouthwash is a tricky one because, I mean, some mouthwashes are really strong and there's good bacteria in your mouth too. So it's very like person case specific.
Fair.
Kind of the same thing with fluoride. Like if you have a really acidic environment in your mouth and the bacteria are rampant, yeah, we're going to do everything we can to get the bacteria under control so you don't lose your teeth.
Yeah.
Is it necessary for everybody? No.
Yeah.
So I say whatever works for you, and you should talk to your dentist and figure out, what the best oral hygiene routine is specific to you.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanethealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanethealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on, premium, intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massaged or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. Let's talk about x-rays really quickly. What about them?
A lot of people refuse x-rays.
Really?
Yeah.
How are you supposed to work on their teeth without?
Thank you.
Yeah. Is it because they're like afraid of exposure or
worried about the radiation? And I think,
but if you broke your arm, you would get an x-ray.
Well,
I would hope.
Yeah. And dental x-rays, the technology has come so far. The radiation is so minimal. Like you get more exposure from going through the airport x-rays when you fly, or even being in the air flying.
So are you going to walk to your next vacation because of radiation?
Exactly.
Right.
Yeah. Like you come in twice a year.
Right.
We take a set of x-rays, and that's just so we can see what we can't see with our eyes. So I can't do like a thorough exam if I don't have x-rays, because, if I say that I did an exam and you refuse x-rays and I miss something and you need a root canal, that's on me. And
there's certain stuff that you just can't see just by on the outside of it too.
There's a lot that we can't see. And you want to catch things early. So that's just one thing I want to point out, because I have quite a few patients that don't want to get them, and then I educate them why, and then they're like, oh, okay, let's do it.
Well, and I completely understand wanting to avoid as much toxicity and as much radiation
exposure.
100%. But it's good to know, like you said, that technology has advanced so much that twice a year, you're going to be okay.
And we typically just take x-rays once a year anyway, unless you're like high cavity prone or have something that does hurt. Then we want to make sure that we don't miss anything.
Yeah. Let's do a quick touch on diet.
Yes.
Just what's the best way to avoid cavities?
So cavities form because the bacteria in your mouth eats a fermentable carbohydrate, which a lot of people think is just sugar, but that could also be bread, that could be crackers, that could be any kind of carbohydrate that sits on your tooth. And then that's what the bacteria eats, releases acid breaks on your tooth. It's pretty straightforward. So all you have to do is get that carbohydrate off, and you shouldn't be getting cavities. But some people have really acidic mouths. So you can even do some kind of pH testing to see if your saliva is more acidic than others. There's a certain pH that your teeth will start to break down at. And so if you have a more acidic mouth, then your mouth is going to, or your teeth are going to reach that threshold a lot sooner than somebody that doesn't have as much of an acidic mouth. So it's way easier, way more cavity prone. And that's when I would recommend something like fluoride to bond to your tooth structure to make your teeth more acid resistant.
So going back to diet, what is the optimal things? Obviously, like you always hear, cut down on sugar, don't drink soda.
It's really the acid, the acidity, and instead of amount, think about frequency.
Okay.
So a lot of patients are truck drivers. They're sitting in their trucks sipping on soda all day. Even diet soda, super acidic. And so all day, that's going to cause breakdown of your teeth slowly, but actually kind of quickly. Because it's like that constant exposure. Your teeth never have time to remineralize themselves.
What about coffee?
Coffee, same thing. It's acidic. You don't want to be sipping on coffee all day.
Is it better if you drink with a straw?
Yes. Yeah.
I feel really guilty. I'm a straw right now.
I don't drink coffee through a straw, but I only have 1 cup a day. Have it in the morning, and I drink it within 30 minutes.
If you drink it and then you brush right after, does that help? Whether that's soda or
no. You could rinse it like with water to make it less acidic, but you actually don't want to brush.
Right, 30 minutes.
You want to wait like 30 minutes so your teeth can rebuild themselves, so you're not brushing away your tooth structure.
Sure. What's the most important part of smile?
Oh, I love this question. I think it's just like your confidence. So
I love that.
When I was 8, I knocked out my front tooth with a golf putter.
You can't tell it. Your front teeth look beautiful.
Thank you. One of them's a crown. So,
wait, with the golf putter, how did you do that?
It was stuck in my bag, and I knocked my tooth out.
How?
It walked out. I don't remember it. Oh.
I'm sorry for laughing.
It was traumatic. It sucked, but honestly, it's one of the reasons I became a dentist, because until I turned 18, they want to wait. You want to wait until you're 18 for your bones to kind of stop growing. Like you go through your growth spurts. So they just glued a little fake chunk of composite on my front tooth, and it was like brown. So my whole life until I was 18, I had a brown front tooth. And
that's unfortunate.
I wouldn't smile in pictures. I was so self-conscious. I knew I wanted to be a dentist, but I didn't really tell people because I didn't want them to look at my mouth. And I honestly didn't really care about taking care of my teeth as much too, because I didn't care about them. Because I didn't like how they looked. And so my 18th birthday, my parents got me a crown for my birthday.
I bet that felt so good.
Especially
because like 8 is such a young age, and it's so sad that like you shouldn't have to be thinking about like your teeth are like smiling or any sort of anything that you feel insecure about. It's like you're 8 years old. You don't have to worry about that.
Especially like my teenage years, I was really insecure about my teeth. And when I got my crown, it just like totally changed my confidence.
Did you start smiling more?
Oh yeah.
Like I smile every day.
I smile everything. So that's a really cool gift that I get to give to people.
100%.
A lot.
Now you're a dentist. Is there something that they could have done differently
with my teeth? it's really hard to match one crown on a front tooth.
Yeah.
And beauty standards today, symmetricality is what's considered beautiful. And so typically if I'm going to redo a front tooth for somebody, I typically recommend we do the front two.
Yeah.
Because then we can make them symmetrical.
Yeah.
I like the results more. Patient likes the results more. It just makes it easier for everybody.
Yeah.
Because it's really, really hard to match. My dentist did a great job matching my front tooth. But
yeah,
eventually I'll probably redo them.
Yeah. You can't tell. They look great.
Thanks.
I love what you said about confidence being the most important part of a smile, because I think in all reality, whether we're talking about any area of like beauty, health, and fitness, it's like I had a realization when I was in college and I was hanging around this group of girls who I had always like looked up to and been like, oh, like they're like the most beautiful, like most perfect in my eyes. And I started hanging out with them and I realized they were so insecure about how they look. But talking about like, oh, like I need to like skip a meal, so I look at her, I'm like, you're so skinny. Like, what does that say about me? And then it was like they had flawless skin. Like I had struggled with acne like my entire life, and it was like, if you think that your skin is bad, like what does that say about me? So it's like I came to realize that a lot of times people that you might on the outside think like, oh, they look perfect. If only I look like them. If only I had their teeth. If only I had their body. If only I had their this. It's like that doesn't really just be like, it doesn't mean that they feel any less insecure than you do. And a lot of times, like what's preventing us from feeling beautiful, it's like, it's really an internal thing more than it's an external thing, because you're never going to reach a place where it's like, now I'm perfect. Now I like, feel good. It's like confidence really does stem from within. And I honestly think like the most beautiful person a lot of times is the person who you see smiling, you see like it's like comfortable in their own skin, you see like radiating from the inside out, because achieving this like arbitrary beauty standard, first of all, it's like it's never going to happen and nobody's perfect. And again, the most beautiful person isn't always the one who is like has the most perfect features. It's the person who like I think embodies your like joy and confidence from like the inside. I don't know.
And that's something like I never want to. A lot of people think that dentists are trying to like sell them things,
right?
And I just want to give people other options. Like I want to educate you on why I think something would benefit you. Like if you have a cavity, I'm gonna say you have a cavity. This is what we can do about it, and this is why it would benefit you. But ultimately, it is up to you. I'm not going to force you to do anything. So same thing with, if somebody has a gap between their front teeth, I'll say, hey, do you like your gap?
Yeah.
Is it something that bothers you? Do you want it closed?
Yeah.
If not, you're beautiful the way you are. Keep 100%. It that way. It's really easy to keep clean.
Yeah.
So I don't care. But if you want your options, can we talk about cosmetics? 100%.
And I don't think cosmetics like enhancing what you want is, I don't think it's a bad thing. Like, I think what's important is that you feel confident in your own skin, and it's not because of some outside force, but it's like, if you want to fix that, by all means, like
I can do that for you. But if not, like, unless it's a functionality issue where I'm like, this is why you need to change your bite or blah, blah, blah.
Yeah.
Then we'll talk about that.
Okay. So moving to Q&As. Just a couple of them that we have time for. Do tongue scrapers really work?
Yeah. They do scrape your teeth. They do.
I guess, what do you mean by that? Like, do they...
a lot of people don't brush their tongue or scrape their tongue, and they have bad breath. So if I always check people's tongues, like when I do their exams, and if there's a bunch of like buildup bacteria on their tongue, I recommend a tongue scraper for sure. Yeah, but it kind of same thing like with the salivary fluid that we talked about. If you have a lot of saliva, a lot of times that'll clean your tongue kind of for you.
How do you fix that, by the way? Like if I feel like my mouth is always dry,
there's a lot of things. There's some medications you could take, which I don't recommend unless it's severe. There's like little xylitol is actually really good anti-bacteriogenic, which means anti-cavity. And it helps stimulate salivary production.
Yeah.
Yeah. So there's a bunch of like over-the-counter things you can get for dry mouth.
Love it. Okay. Is an electric toothbrush better?
Yes.
Yes. Okay.
Studies show that it's not. If you know how to use a manual toothbrush correctly, then by all means.
I think the problem is people are lazy.
It's compliance.
Yeah.
It's really...
It's not about whether or not, I guess, it works better. It's more about, do you work with the manual toothbrush?
Yeah.
Yeah. Okay, best toothbrush for travelers.
She's
like, I haven't asked this one before.
Yeah. Well, I like my Sonicare. It comes with a little travel toothbrush.
It is. Beautiful. Yeah.
Yeah. That's what I'd say.
Yeah. Best toothbrush is the one that you use. Teeth sensitivity to cold. It's a question from. I'm assuming the question is, what do I do about my
tooth sensitivity
to cold?
So you have all these little tubules in your teeth, and if those tubules are open, you're gonna feel the cold air on your teeth. So something I recommend is get like a sensitive toothpaste, put it on your finger, and rub it into your teeth and let it sit on your teeth all night.
Okay.
And I'll block those tubules and it'll really help with the sensitivity.
That's a really helpful hack. Yeah, I don't think I do that.
I tell that to a lot of people and they're like, what?
I love that.
It's cool.
With that, we had another person ask, best toothpaste to use.
Pretty much all toothpastes are created equal.
Love it. Is there any
don't use charcoal?
No charcoal.
No charcoal.
Why?
Charcoal will whiten your teeth, but it will also scrape your enamel off. It is super abrasive. So avoid charcoal toothpaste.
Yeah. Best teeth whitening at home.
At home. Personally, I use pressed white strips.
I do too.
It really just depends.
Yeah,
it depends.
Yeah. Okay. Can you explain the proper eruption timeline for deciduous teeth?
Who asked that?
Guess who?
A big dog can eat.
I don't know what that means. What type of cells mediate wound healing after a tooth extraction? Okay, we got one more. Can you explain the hydrodynamic theory of pain?
I hate them.
Luke and Skylar sent those in, fellow dentist friends of ours. So,
I don't remember.
He's like, I don't use that on a day-to-day basis in my clinic. No, they were like, this would be funny if we sent it in.
That is so funny.
They were wait to see her face. Who asked that?
Oh my gosh. Deciduous teeth are baby teeth.
Okay.
Yeah. Yeah. So the proper eruption sequence is what order they're supposed to be in.
Oh,
one thing we could talk about for kids.
Yes.
It doesn't, like, there's not a firm timeline on when they should be getting their teeth.
Okay.
Every kid is different.
Yeah.
It's the order that they get in, that they grow in, that really matters.
So what should that be? Like if I'm a mom?
So the front teeth should come in first, and then the ones right next to it. And then the little baby molars, and then the canines, and then the back baby molars.
Have you ever seen a kid come in that's like sprouted all over the place, but it's like not right?
Yeah, so a lot of times we'll take a panoramic x-ray and then you can see all the tooth buds starting to form too. It's actually crazy how many people are missing teeth.
Really?
Like they're just congenitally missing teeth. And a lot of times you'll ask their parents and they're missing the same ones.
That's crazy.
It's all genetically. Yeah.
Does that cause problems?
Most of the time, no.
Yeah.
A lot of people still have some of their baby teeth, and those baby teeth actually are fused to their bone, so they sit lower in the mouth and they can't really use them for function. but they're just holding space there. And
we end every podcast with a practical step for listeners. Like if someone listening to this forgot everything except for one thing today, what would that be?
Just start a routine.
Yeah.
Just make goals, do your best, encourage others to do their best.
Yeah. Miranda, thank you so much for being on today. I loved chatting. I think this was my first time interviewing. No, actually, it's not true. I was going to say interviewing a guest in person. So
sweet.
Yeah. So we had a lot of fun. And I'm so grateful for your time again. And I feel like I learned a lot. So if you guys have questions for Miranda or for future episodes, feel free to DM us at the Weird Wellness Podcast on Instagram. And also be sure to subscribe if you're listening to this on YouTube. And if you're on our audio versions of the podcast on any streaming platform, Spotify, Apple Podcasts, please be sure to leave us a rating and go ahead and check it out on YouTube if you want the video version of this podcast. We post new episodes every Friday. Yeah. Thanks so much, Miranda.
Thank you.
It was so fun. Bye, guys.
Bye.